What is ERP, exposure and response prevention? So it is 60 to 85% effective. I think that's correct. Sometimes I get numbers mixed up. So, but somewhere in that range when done. So they used to think that exposure and response prevention worked because of habituation only. So what is habituation? Habituation is when you face a fear repetitively and over time you cannot hold that same level of anxiety, you will habituate to the thing. And eventually it will get easier and you won't feel as scared of the thing that you're exposing yourself to. So an example of habituation, really simple, would be I am afraid of snakes. I'm going to look at snakes every single day. I might even eventually get in person with a snake, touch a snake. Eventually my body won't be able to hold the same level of fear. I will habituate to it. I'll get used to it. It won't be as scary anymore. Okay, they now know that ERP works not just because of habituation. Some people get better with ERP and never habituate. Mind blowing. So why is that? And they call it the inhibitory learning model. So the reason is that we are creating new learning to inhibit the old learning. So what that looks like is by facing your obsessions and not doing a compulsion, or by having your clients face an obsession and not doing the compulsion. They will create new learning that they can do this, that they can face the fear and not do the compulsion. That will counter their old learning that they have to do compulsive behavior to feel better. I know, mind-blowing. I love this. If you want to learn more, check out my class for therapists. It's approved by NBCC and by NASW. It's a live webinar, 6 continuing education hours, and I will explore all of this. Diagnosing, ERP treatment, and we're going to talk about inhibitory learning model, racial differences to consider. Learn more at kdhcollective.com.